I was advising women on their health, and I was 50 pounds overweight, not healthy.
Why do you care about this kind of metabolic change?
We need to address the weight and stop just giving people diabetes medications.
What stuff do you see that just makes you totally scratch your head?
What really drives me crazy is people getting prescriptions online. They can just fill out a form, they get the medication shipped to them, and they lose weight. And then I show them, like, okay, you're still 48% body fat, and you have sarcopenia, meaning that you've lost too much muscle.
It's wild to me when people are willing to use their bodies as a laboratory experiment.
What's going to happen when they stop? They haven't learned the proper nutrition or habit. What's the underlying cause?
All right, welcome. Today I am with Dr. Barbara Hessel. She's an MD, board certified in obesity medicine, gynecology, and nutrition coaching, and a women's health expert with 25 years of experience. She specializes in helping women get their body back to their happy weight by managing hunger and appetite. She's helped thousands of women regain control of their hunger, hormones, and weight using her 3-step framework, the Metabolic Momentum Method. Thanks for being here.
Thanks, Jim.
How about that dinner last night, huh? It was so good, wasn't it?
It was great.
We were talking about food, and like last night's dinner was like unbelievable. I had such a good time.
Yeah. I love being able to tell people that they can eat whatever they want, but, within boundaries. So that was a good example of that dinner.
Yeah. What kind of boundaries are important for women, especially women that have, really struggled with their weight and their metabolism over the years?
Yeah, it's really surprising. People come in and they think that they're eating right, they're eating clean, and they're not seeing anything move on the scale. And then when we go into more depth, we usually find out, what they're not eating enough, or they're eating too much of something else, and we adjust that. They see things start to shift right away.
One of the things that I've seen over the years of being in the health and wellness world for over 20 years is like the yo-yo dieting phenomenon. And then what happens when the weight sort of drops and, when they regain it. And I'm certainly not an expert like you are on all of the nuances there, but I'd love to hear kind of you explain what happens to the metabolism and to when people, do these kind of the diets and then they have that rebound effect.
Yeah, that's a great question. So our metabolism slows as we lose weight, and it's also often compounded by the fact that we lose muscle as well. And muscle is more metabolically active. So when our metabolism slows, that means that we need to eat less calories to maintain our metabolism so that we don't keep regaining weight. And that happens with any kind of weight loss, and then especially people on GLP-1 medications.
And so when we talk about metabolism, basically we're talking about like how many calories the body burns at rest, or just like how efficient someone's internal engine is?
Right, it's a combination of those. So one thing that we look at is the basal metabolic rate, or BMR, and that's how many calories that your body needs just to function at rest. So what's interesting and people don't realize is if you are either calorie restricting through dieting or calorie restricting by being on these medications, if your body doesn't get enough calories, it'll start burning muscle and to get the nutrients that it needs. And then that slows down your metabolism even more. And then when your metabolism slows, then it's easier to regain weight. So it's always like, why am I plateauing? Why am I regaining weight? It's because we messed up our metabolism.
So that resting metabolic rate, so the amount of calories that are being burned at rest, as somebody is losing weight and in calorie restriction, that number goes down, right? So like, is that right? Like they're burning fewer calories at rest, or no?
It will go down as you lose weight.
As you lose weight and you lose muscle, right? So
Right.
it's like
It goes down also just as a function of how much you weigh.
okay.
But at the same time, like if you see your skinny friend who's always been skinny and they can eat a lot more, it's because even though you're like, well, we're the same weight now, why can they eat more? It's because of this differences in the basal metabolic rate.
And so let's talk about muscle, because it's something that, is talked about all over the place. Like you need to have more muscle. Muscle loss is a big concern. Why should women that are trying to lose weight care about what's going on with their muscle composition?
Right. So I know a lot of people come in and they're like, I just want to lose weight and fit in clothes and look skinny, which is great. We all want to look great, right? But underneath that, so the immediate effects are feeling weak and also being more prone to getting infections and being sick because our body needs, a certain amount of muscle and protein to function. In the long run, which people don't always think about, is when women get older, they can get frail. So that's a concern in the long run. But in the short run, people just don't feel well because they're feeling weak and tired and exhausted.
Hmm. And you mentioned GLP-1s earlier. Let's talk about that because this is obviously like all the conversation
Right.
now in the weight loss world.
Yeah.
What is a GLP-1?
So it acts like a hormone that our bodies normally make after we eat. The GLP-1 levels go up. It tells our brain that we're feeling full and to stop eating. It also slows down our stomach emptying so we stay full longer. So when you take the medication, you're getting very high levels of GLP-1 in your system. So that's why people feel full, they eat less, their stomach empties more slowly, so they're actually full longer.
And so this is we're talking Ozempic, and then what are the other ones? Is Wegovy?
Manjaro, Wegovy,
Okay.
right?
And
Zepbound.
yeah, and so that would make sense that people are like interested in those, right? Because of that. If it helps you feel full longer, then what they're able to obviously not eat as much.
Right.
And I've heard mention of food noise. What is this food noise that they talk about?
Yeah, food noise is interesting because a lot of us don't realize that these hormones are acting on our brain. So it's acting on centers in our brain that even control cravings. They're finding that people drink less alcohol when they're on them, for example. So it kind of quiets this part of our brain that's always telling us, like, go search, look for food,
Yeah.
look for reward, right?
And so what's your overall, clinical feeling about GLP-1s? Like yay, nay?
Right. They do work great for certain people, and people will see, remarkable weight loss on them. But people really have to be careful that they're getting the proper nutrients. Otherwise, they're just going to get sick on it. And also, when they want to stop, if they don't have the proper nutrition and eating habits, if they haven't learned how to do this while they're losing weight, when they stop, they're going to regain the weight. We want to avoid that, of course.
Yeah.
Right.
So describe the kind of woman that it's that a GLP-1 is great for?
Um, it really depends. People who want to see faster results that get a lot of benefit from that,
Mhm.
like for motivation. So it works for a lot of people.
Is there like a threshold for how much weight someone has to lose? Like, does it matter if they want to lose 20 pounds or someone that's, morbidly obese and has a lot more weight to lose? Or does it not really matter? It can be effective across all those levels.
But no, I don't go by a strict weight limit.
Hmm. And what are you mentioned like not having the proper nutrition can contribute to side effects. Is that like the main key around the side effects, or is there other stuff just as the nature of the medication where some people just might interact with it in not a good way?
The side effects are worsened if you're not eating proper nutrition. Um, if you're not paying attention to like fiber, how much fiber you're getting, how much water you're drinking, protein, veggies. If you're eating too much fatty foods, all these make the side effects worse. But it's really just the long term that I'm more concerned about. Because people are getting rapid results, they look great, but in the long term, it's just not healthy. It's just not good for you.
Mm. So when you use them in your clinic, are you like I have no idea. Like, what is the average course of time that someone might be on a GLP-1? Or is it still kind of like, it feels a little bit like the Wild West, where it's like, it's just everyone's sort of figuring it out as we go now.
Right.
I feel like it's just sort of like, I know they've been around for a while, but like, it's like in the last year or two, it's like they're just like in the market, and now it's like,
Right. Yeah, that's partly true. And as much as the medical studies, they follow them for 18 months, and now they're looking at longer term. But you're right, we don't know long term yet. But It varies from woman to woman, so everything's individualized.
Mhm.
That when you get to your goal weight, we see, can we stop it? How do you feel? Can we lower the dose? Can we spread it out? So instead of doing it once a week, maybe it's every 10 days or every 14 days, depending on how you feel. And everyone's different. Some people will always need to be on the highest dose. Other people don't even have to get to the highest dose to get to the results that they want.
Amazing. And like, it's from what I know about your work, and like we were talking about earlier, the having that sort of like sensitivity, like one of the things that I hear about how you do things is like it's very personalized as opposed to just sort of like a blanket prescription for everybody. And
Right.
like talk a little bit about how you personalize the care for your ideal clients.
Sure. So when someone comes in and we want to talk about weight management, so we see what they've done in the past, what's worked, what hasn't worked, what their goals are. We set a realistic time frame, and we actually yeah, create a nutrition program and movement program for them first. And then we talk about medications. And that's also, the medications come in based on what I call a hunger code. So there's 4 different types of hunger that drive weight gain. So one is hungry brain, and that's when you have to eat a lot before you feel full. The signal's not getting to your brain that you're full. There's something called hungry gut, where you eat and you feel full, but then you feel hungry soon after. Um, there's emotional eating, of course, which is a big one for a lot of people.
Yeah.
And then there's slow burn, which is a low metabolism. So people might see this. We were talking about BMR, so they might see this after weight loss or muscle loss, that the metabolism is slow. So depending on your hunger code, then we could also tailor the medication, talk about which medication would work best. Or, what other things do we have to address? Like if you're emotional eating, then we have to look at what are your triggers? How can we, you know, treat that as well?
Yeah, let's talk about emotional eating because it's such a big thing. What are some like? Do you have any tips or tricks, or the how does your expert lens view emotional eating?
Yeah, emotional eating's funny. A lot of times people don't even recognize it. I've been guilty of emotional eating myself. So when I was in residency, I was really tired all the time because we were working crazy hours. And I would eat, like a lot of Doritos, for example. I'd be like, well, I'm tired. I need the energy. Or I'm tired. I deserve this. But it wasn't because I was hungry. It wasn't because I needed nutritional value. So that was emotional eating. I wasn't even recognizing. That was stress eating, right? So that all
Mhm.
falls into that. People might not recognize when they come home and they're just like grazing. That's emotional eating. Or even if it's a holiday and you're celebrating, that still falls under emotional eating as well. So it depends on, the circumstances that are triggering it. So
Mhm.
so we look at that. So there's recognizing that you're even doing it, and then recognizing the triggers. Let's say if somebody notices that they have emotional eating when they're upset for some reason, there's different options. So one is, you could recognize your emotional eating. You can eat what you want, just own it and move on. Don't like keep going down the rabbit hole.
Mhm.
There's also, you can substitute what you're eating for something healthier. So you're still emotional eating, but making like healthier choices, or you can get up and go for a walk, drink some water. Um, Another option is to like just go with your feelings and look at like, why am I feeling this way? What's triggering me? What's underneath it? Instead of
Mhm.
just trying to cover it up.
Yeah, with
Right.
another slice of pizza.
Yeah.
Yeah.
Exactly.
I had a patient when I was practicing acupuncture. I had a patient who she would eat like half a tub of cream cheese at night. It was like she said she would like literally get in bed and just like be laying there sort of trying to fall asleep, and then she would just get up and she would binge
Right.
the cream cheese.
Right.
Yeah.
Yeah.
She was like, to be fair, it's New York cream cheese from like her favorite deli. She's like, it's really, really good.
Yeah,
But
it's
it's
great.
you know, it's like it's heartbreaking because, you know, it's like she was just packing on all of this extra weight.
Right.
It's really, really, really difficult.
Yeah.
So when we've got the hunger code, how do you figure that out? Is that like poignant questions? Is there like lab work that's involved? What goes into that kind of
That's an
assessment?
interesting question. This work was originally out of Mayo Clinic, and they're actually looking at DNA phenotyping.
Well,
I don't think it's necessary. I feel that if you really talk to someone, you understand what's going on, right?
yeah, and that what was it, the one for the brain? Is that a breakdown in leptin and ghrelin? I've heard like some of these words out there in the ether, but I'm not entirely sure how that plays together.
Yeah. So hungry brain. Yeah, the signal's not getting through. So that would be a ghrelin issue. Of course, we don't treat ghrelin directly. We treat like, do you need to, like adjust your diet so that you fill up on more fiber and veggies and protein as opposed to filling up on more carbs, which is going to drive your weight gain.
Got it.
Right. Yeah.
Yeah, and so with your background, obviously, you could focus on so many different things to help women live their best lives. Why did you help them lose weight, and why do you care about this kind of metabolic change?
Right. Yeah. Uh, it just, well, it started personally that I gained a lot of weight during residency, like I was describing. And I was really 50 pounds overweight. And I didn't feel like it was affecting me till I would look at photos. And I just hated looking at photos myself. So, and I was always trying different diets, like everyone else, like trying keto or intermittent fasting or, cabbage soup, all those, everything crazy, right? And I would lose weight, but gain it back. So when I finally figured out what I needed to do to lose weight, then I said, oh, I looked at all my patients, and the incidence of overweight and obesity in the US is 75%. So it's more than half my patients. I said, well, I can help them too, and they need it because it's affecting every part of our lives, right? So I'm doing obstetrics and gynecology. It's affecting your pregnancy. It's affecting your menopause. It's affecting when you transition through menopause. Yeah, so I just went from there. Like I wanted to help everybody.
Yeah, and that experience, you're definitely not alone of like looking in the mirror and
Right.
seeing photos and just being like, oh, right. Because sometimes the change is like slow. I mean, I've noticed it for myself, but now I'm in my mid to late 40s. It's like you can't always see if it's a weight creep until
Right.
you get some photos or something. I joked with my wife a few years ago. I was just like, did we get like a new dryer? Like, why did all of our clothes start to shrink at once? And it's like, no, that's just other things, maybe too much emotional eating. But didn't you have a story about like a true New York story where someone like yelled at you on the street or something?
It's true. Yeah. I was getting bags out of my car and somebody was trying to pull it and they literally yelled, "Move your fat." But, well, but in New York speak. And yeah, it's New York. So of course I ignored them, but inside I was just like, I felt terrible. I felt terrible. And also I was, not just how I looked, which of course is like the big thing, but underneath I was like advising women on their health, and I was not healthy, not healthy,
Hmm.
right?
Yeah. And then that feeling of, I mean, on some level, it's probably an imposter feeling, right? Of
Right.
just like,
Yeah.
ooh,
Yeah.
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 And so what is life like now that, or like when you lost that weight,
Right.
and you were able to keep it off, like how did things change for you?
Um, yeah, I mean, just like in general, of course, I feel better about myself. I feel stronger, like going to the gym and working out, and that's a good feeling. And then, I like being able to keep up with, like my nieces and nephews who are younger so that I can be more active with them without feeling tired or out of shape. But, in the bigger scope of things, I really like being able to help people get back to their health and maintain their health and, continue doing that.
Yeah, let's talk a little bit about that because I find that at least in my experience back in my practice, the clients that were motivated by like preventing illness and
Hmm.
like the ones that recognize that the obesity was like the warning signal. Like, of course, everyone wants to look good, and like that's all great, and the
Right.
vanity thing is great.
Right.
But the ones that were motivated because they say, hey, I saw, my parents were overweight, my parents
Right.
had diabetes, and they recognize that the weight is like kind of this metabolic, what would you call it? Like it's like, it is like the thing, like the main indicator for what the rest of your life could look like from the
Right.
health trajectory.
Right.
Talk a little bit about, let's just sort of flesh out the dangers of keeping that weight on and um, staying obese.
Right. Yeah, it's really interesting because the shift has been from treating, say, like chronic hypertension and diabetes to shifting towards treating overweight and obesity as its own medical problem because they found that the fat by itself causes inflammation. One of the things that we look at in the clinic is visceral fat, which is how much fat is around your organs. And that's what also leads to the development of hypertension and diabetes. So as opposed to, like, oh, I need to lose weight to look better, maybe these other things will get better. It's really that we need to address the weight and stop just giving people diabetes medications or giving them antihypertensives because that's just like putting a band-aid on things. It's not getting to the root cause of what's driving these metabolic changes.
And so are you seeing this as kind of a sea change in medicine, or do you still have plenty of people that are just like, take metformin, your blood sugar will be fine?
Right.
Or are you seeing like across your colleagues more of this kind of conversation of like, we have to address this metabolic dysfunction?
Right. So, I mean, I'm board certified in obesity medicine. And so, from that angle, this is where the shift has been coming from.
Hmm. Yeah.
Yeah.
You mentioned checking visceral fat. Are you guys using DEXA scans or bioimpedance scales, or how are you able to do
Yeah. I
that?
use a bioimpedance scale
Hmm.
to do body composition.
Yeah. I have one at my house. It's a Hume Health. Do you know
Okay.
about that one?
I do.
Is it any good?
Um, it's good. I wouldn't consider it medical
Not
grade.
medical grade. Yeah. Yeah. They got my attention because they were like, I used to work in a clinic where we had a DEXA,
Okay.
and they got my attention in their marketing because they were just like, we're like 98% as accurate
Oh, okay.
as a DEXA. But now that I've been using it, I'm not so sure about that.
Right. Yeah, but the one with the
The
handles.
handles.
Okay. All
Yeah,
right.
yeah. But yeah, it's from what I've been learning about the visceral fat, it's like
Right.
that seems to be like enemy number one when it
Right.
comes to
Right.
like if you really want to reverse some of the lab numbers.
Yeah, and the treatment for that is weight loss.
Yeah.
It comes down as you lose weight. So
Yeah.
it's something that we follow, we monitor. In addition, we follow uh, muscle mass. So we see if people are losing skeletal muscle as they're losing weight and try to really, you know, get people to focus on protein and weight bearing exercise. Right.
And the weight loss, I meant to ask you this earlier, the muscle loss that happens on GLP-1s,
Mhm.
is there like is it a mechanism that's based like on how GLP-1 is interacting with the muscle? Maybe we don't know this, or is it just the fact that people aren't eating as much and then their muscles just don't have the nutrients that they need?
Yeah, they're not eating enough.
Yeah.
Yeah.
My wife mentioned this phrase, what is it, Ozempic butt? Have you heard that?
Oh. Yeah, that's a big face. That's a big
Is it?
face.
Yeah. Um, Okay, interesting. So let's talk about the role of exercise. You've mentioned it a few
Hmm.
times. Is there, I think I know the answer is there like a one size fits all exercise? Or like what are some of the considerations that you pay attention to when you're working with someone?
Right. So the ultimate goal would be 150 minutes a week, and you want 3 days of like resistance exercise. But we don't start everyone there. We start people where they're at, obviously. I have some people who aren't even walking enough, so just try to get them walking.
Resistance exercise being like moving weight, or would that just like the incline treadmill? Does that get it done?
Yeah, lifting weights or using bands.
And what are some of the other factors that you consider when coming up with a healthcare plan for your clients?
Like a movement plan?
Hmm.
Yeah, it's just basically starting people where they're at, seeing what they can do, where they can add a little bit more. Anytime I start people on any kind of, whether it's the nutrition or the movement, I like to set minimums. Like, what's the minimum amount that you can commit to? Like, yeah, we'd all like to work out 5 days a week, but let's be realistic. Like, if we set that as your immediate goal, you're bound to not be able to do that. And then you're going to feel like, oh, I failed, right? So, what's the minimum that you can commit to? And if it's even just one day for 5 or 10 minutes, then that's where we'll start. Absolutely.
You mentioned earlier also about how when you were gaining weight, you had tried like keto and intermittent fasting. Um, what are some of like just the dangers, or like why doesn't something like keto or intermittent fasting, why don't these fad diets tend to work for people long term?
Right. So they'll work in the short term and they'll work for some people who are really committed to it, but you have to be consistent with it. And it does studies around both of them that most people are not able to be consistent, so that after 1 year, they will not been able to maintain it and they've gained all the weight back.
And is that like a lack of willpower, or like what's the problem there?
No, it's just life. I mean,
Delicious food
you,
is
you
just too
can't be too
delicious.
restrictive, right? Yeah, yeah. So intermittent fasting, like people are like, oh, I just like skip breakfast. It's not actually that. It's like having like a set window. And if you're going to drink anything, it's black coffee. So you can't have any cream. You can't have any sweetener. You can't have anything that's going to cause an insulin spike because then you physically broken the fast.
Mm-hmm.
Yeah.
Mm-hmm. Let's talk about insulin a little bit, because I feel like that's sometimes sort of, it's like it's a big undercurrent of a lot of conversation with health and wellness. And they talk about like going for walks. I've heard people say it's important to go for a walk after you eat
Hmm.
to help regulate insulin. Should people be like, what is it about insulin and sugar spikes and all of that, and how it can like hijack some of your appetite or weight gain or anything?
Right. Well, insulin is what actually drives weight gain. Insulin causes your fat cells to take up the glucose, turn it to fat. So that's what drives weight gain. To avoid insulin spikes, yeah, you want to do things like you you can eat your carbs at the end of your meal. So you're getting your protein and veggies first. That lowers insulin spikes. Also, walking after a meal will lower your insulin spikes. Getting back to exercise, your muscles also interact with insulin. So having, like good muscle strength will lower your insulin.
Nice. I would imagine that, like I've heard people say with ER doctors, like the sort of the job satisfaction is sometimes can go down, or they have that stress because it's like so intense and like the ultimate triage, and then like the patient goes somewhere else and they do all the rehab. But I would imagine that for your job, it's maybe the opposite, that you get to see like the initial labs when people come in, and then
Mhm.
the follow-up labs as they've dropped the weight, and
Right.
like you get to see all the stuff go back in the green and normal
Yeah.
and optimal. Just talk about the kind of satisfaction that you have with your job.
Yeah. No, it's actually really satisfying. It's funny because I always feel like I've been like a goal-oriented person. So like went into obstetrics. So if you come in and you want to have a baby, we take care of you. End of 10 months, you have a healthy mom and a healthy baby. If you have a GYN problem, we try to, you know, diagnose, come up with a treatment plan, what we could do to avoid it in the future. So I feel like I've really been interested in things where we could diagnose, treat, set goals. And so this was kind of like a natural progression. So I really love seeing people, and even sometimes I'll see people come in for their like an annual checkup, and they've kept the weight off and they've lost even more. And that's just like, it's amazing.
Incredible.
Yeah. Yeah.
Incredible. So what are some of the things that you would say to a woman watching this right now who's, overweight and
Mhm.
frustrated? What are some of what are some of the things that she should consider when she's like thinking about what the next step is to try to lose weight, especially if she's tried a whole bunch of stuff before and just hasn't been able to lose weight and keep it off?
Right. Well, the way that we approach it is to really look at everything, look at the whole person. Like I said, try to determine like the hunger code, what's been driving your weight gain, what's the underlying root cause, what's the best way to address that, and then come up with the plan that also fits, like, are you already on medications, your lifestyle, what you like to eat. I don't like things that are too restrictive. So we talked a little bit about like keto or intermittent fasting. These things are too restrictive. And things that have women tried on their own, like I cut out all carbs and I cut out all sugars. I don't know why things aren't moving. So, and then we use also, like labs and the body composition to really get to the science of it and then come up with a plan.
Yeah, you talk about medications there.
Mhm.
Let's explore that a little bit because I feel like, and correct me if I'm wrong. I mean, someone that is, perhaps dealing with some health conditions
Mhm.
that is already on medications. Um, to me, it would seem like a no-brainer that I would want to reach out to an MD like you who has sensitivity to the medications that they're on, understanding how the medications can be contributing to like obviously everything in their health, but in particular, like how maybe it interacts with holding on to weight, as opposed to just like hiring a local trainer or like following some like Instagram like
Right.
workout person and thinking that that's just going to be the solution for them.
Right. Yeah, I mean, if people just want to lose weight but aren't concerned about their health and the effects on their health, that they can certainly, get a coach or even get a prescription online. But this is not for people who are looking for quick fixes, people who really want to maintain their health or get healthier and then stay healthier, not just a number on the scale.
Are there medications that can make losing weight more difficult?
There are. So people who are on insulin, like we said, insulin drives weight gain. There are certain antidepressants. So sometimes, we would work with someone's psychiatrist, for example, to see if we could switch something. Of course, if people are on medications that are working well for them, there's also other ways. We don't want to stop things and, like mess up your mental health treatment, for example. There's other ways to address it, either through nutrition or adding other medications.
Yeah, excellent. That there's like a nuance and a dexterity that I enjoy when I'm talking to you and looking at your stuff that you bring to this weight loss conversation. That's um, to me just like seems really logical. It makes a lot of sense compared to, I'm just going to figure it out on my own and
Right.
not eat breakfast or eat within like a 3 hour window or only eat like watermelon. Or I mean, there's just so much crazy. There's so much crazy stuff out there in the weight loss world. And I mean, it's crazy to me, and I'm just like sort of
Right.
like a general health minded person. But for
Yeah.
you, as like a board certified obesity medicine
Right.
doctor,
Right.
sometimes like what stuff do you see that just makes you totally scratch your head and just kind of like die a little death inside?
Oh, well, I've tried all those crazy diets, so
So you
I'm
know.
guilty as charged, right? No, what really drives me crazy is people getting prescriptions online. They don't even necessarily even have to have a telehealth with the doctor. They can just fill out a form. They get the medication shipped to them and they lose weight. And I might see them in the office and I'm like, okay, let's do a body composition. And then I show them Like, okay, you're still 48% body fat and you have sarcopenia, meaning that you've lost too much muscle. You actually physically weaken yourself. And they're shocked. I'm not shocked. But that's what drives me crazy. It's just that people are able to get medications without, like the addressing the underlying problem or learning how to maintain their health or what's going to happen when they stop. Like they haven't learned the proper nutrition or habits or, what's the underlying cause.
Yeah. It's wild to me when people are like willing to use their bodies as like a laboratory experiment,
Right.
you know,
Yeah.
like an unsupervised laboratory experiment, as opposed to, using like kind of sort of evidence base, working with experts that have been there before, that have seen all the things. So like the fact that you just get it by the mail is crazy. And the last night at dinner, we were talking about South Park. Have you seen the South Park the obesity movie, where they're making like, they're making their basement Ozempic or whatever?
We're making Ozempic in their basement. Yeah.
I thought that was such a great sort of indictment of like the healthcare system,
Right.
as a whole. And then of
Right.
course it's South Park, so it's silly and ridiculous and all
Yeah.
that.
Yeah. So I feel like it's going to come back around as time goes on and people start to realize what the long-term side effects are. But in the meantime, I'm just really trying to educate people about it.
Yeah.
Yeah.
Excellent. Well, I've really enjoyed this conversation. Is there any sort of final thoughts, anything that we haven't touched on that you would love, you're the woman watching this to know about?
Oh, I would say that, you know, it's you're never too old or too unhealthy or too overweight or too obese to start making changes, like significant changes, and people are still getting, transformations. So I would just say we usually feel like giving up when things haven't been working. So I would try to encourage people not to give up, but try to find, a doctor who would look at everything with you and make up a plan that's right for you, that's individualized.
Beautiful.
Yeah.
Yeah.
Thank you.
One of the things in this podcast series, we talk to people that are, pioneers in what they do and the problems they solve. And a lot of them have kind of like left the traditional system. And what I enjoy about talking with you and the work that you do is like you're pioneering within the system. You're just like, yeah, I'm very much like a MD. I'm working with that. But and you're able to integrate all of the cutting edge tools in a good way, and like really looking at it from a comprehensive angle. And so it's that kind of revolution from the inside, which I get excited about.
Yeah, thank you. That being said, that is also a struggle though, because they've also done studies around this that people need frequent check-ins and mentoring to get sustainable results that make a difference, saying at least every 7 to 10 days for people to be able to get the results that they need. And the insurance, doesn't cover that.
Right.
So that's a struggle.
So your coaching program, the program that's designed for this, does that enable them to have more frequent touch points with you?
Yes. Yeah. So I check in every day, and then once a week we either do a group call or an office hour.
Beautiful.
Yeah.
Yeah, amazing. Great. So for women that want to work with you, how can they find you?
Yeah. Probably the easiest way would be to reach out to me on Instagram, Dr. Hessel, OBGYN.
Perfect. All right. Thank you so much, Doctor, for your time.
Thank you.
Thank you for watching. Be sure to check out Dr. Hessel, and we'll catch you next time.